Good afternoon, everyone. I'm Mike Merson. I direct the Global Health Institute. Welcome. You see, even when you're almost ready to graduate from college, you can't find your seats. I understand. I want to welcome everyone here, our parents and families, friends, faculty, to our undergraduate Global Health Commencement ceremony. For many of you, you've just arrived on campus. Two lovely women in front of me just drove all night and come from, one from Ohio, one from Louisiana, and they just made it here just in time, so that's wonderful. I know many of you have traveled very far, and you have a great weekend ahead of you. I'm just here to welcome you to this event, primarily. I do, though, want to first call out our faculty who are here. We wouldn't have the programs we have if it wasn't for our faculty. They're great instructors and mentors, and they really make our program successful. Those of you who know universities, what matters most are the teachers and the professors that make for our parents that educate our students and help them learn along the way. So I'd like to ask the faculty that are here to please stand up and let's recognize them. I even saw some students clapping. So that's great. Let me say that we're really pleased to our graduates that we're pleased to honor you here, our majors, undergraduate global health majors, minors, students completing the Global Health Certificate in Program 2. It's wonderful to have you all together with us as you complete your time at Duke. We've come a long way at Duke since 2006 when the Institute opened, but I have to tell especially our families that the students have been in forefront of our work. I came here in 2006. I was here 2 weeks, and there was an editorial in the Chronicle of the Duke newspaper scolding me. I had been here 2 weeks, and nothing had been done. Nothing had been done, 2 weeks. And now we have so many exciting programs, and our students are engaged in classes and field work and research and student groups and internships. And I know many of you, all of you parents, you get an email or a phone call, they're going to the Congo, or they're going to Egypt, or they're going to Peru, and you're thinking, oh no, do I say something, do I not say something? Well, what I can tell you is that we take good care of them, and we make sure that their experiences in the field, we know that they're your loved ones, and we make sure that their experiences in the field, we watch after them and be sure they have the best possible experience. And that's very important to us. I am very inspired my years here at Duke by the commitment of our students to make the world a better place. Parents, I say this really with great sincerity, you should be proud of your daughter and son for the passion that they have for making the world a better place, for improving the health of people around the world. We don't have to tell them this, but I have to think that you played some part in their passion and in their success. And I'm sure that they recognize that. In fact, I'd like to ask the students to stand in recognition of their parents and their families for making you the people you are. Thank you. I will close by saying that the tagline of our institute is Global Health Leaders Start Here. It's not just a slogan for us. It's a commitment we make to students every day, whether it be in the classroom or the field. As future alumni, we want them to have the best experience in education possible. And let me say to our graduates that I hope we've exceeded your expectations. You have certainly exceeded ours. I look forward, and I'm speaking here now to the graduates, to staying in touch with you, following your path in global health. There are many challenges still ahead of us in the field. I know you will go far, and more than anything else, I'm glad that you chose the Duke Global Health Institute to be part of your journey to making a difference in the world. I'd now like to conclude by introducing Gary Bennett, And as the students, as our graduates will tell you, he has been a magnificent director of undergraduate studies at our institute. I want to thank Gary for his outstanding leadership and enthusiasm in not only supporting our students, but also in positioning our institute and Duke as a leader in the world today in global health education. Gary, I turn this over to you.
Thank you, Mike, and good afternoon, everyone. I am really excited to be here today, and I know that normally we like to talk about graduation events as solemn occasions, and I'm going to strongly suggest that we dispense with all of that this afternoon, because as I mentioned, I'm pretty excited, and there are lots of reasons for us to be excited, but I think one of the biggest ones is that in addition to our certificate students and our Program 2 students, we are graduating the first class, really the first time in Duke history, first time in U.S. history, really the first time anywhere, the first class of global health majors and minors. And I just want to give them a round. And as our students sometimes say, it's kind of a big deal. And I'm really, really excited about it. So this is a really important moment in the history of our university and in the history of the field of global health. And what I thought I would do for all of you parents is just to try to give you a glimpse into what your students are doing. I know that they are keeping in touch with you because sometimes in my classes I see them texting, and I think they're texting you, probably trying to keep you abreast of all the fun things. They're not? Okay. All the wonderful things that they're doing in the world, and I am sure that some of you are probably hearing a little bit more than you wanted to know from time to time. But yet, as Mike said, I think that some of you are probably wondering why your children are chasing mosquitoes, when so many of you probably have things in the garage designed to fend them away, and why so many of the students are going out into the field trying to chase infections when you've spent most of their lives trying to keep them healthy, and why it is that they go off to these far-flung places that you see in the nightly news. I know from personal experience that some of you have had to get on Google to find out what countries your students have wound up in. And so what I wanted to do was just to spend a few minutes telling you about this class, what they've been doing, and why we're so excited about them. So first of all, the class of 2014 has forged what I think of as very distinctive educational paths. Now, if you're like me, you went to college, you got a hat, and you kind of shook it up, you put your hand in, you pulled out your major, and it was just that one major. That's all you did. You did your one major. And it was probably the case that your major, and often your professors, had been around for a couple hundred years. But this isn't the case with our students. This is a sort of a new day. They're forging a really distinctive way in the world. They're both consuming knowledge as they're creating it. And I think that's just a really exciting way for us to construct an undergraduate education. Today we're honoring 4 very special groups of students. We have those who have earned the Global Health Major, the Global Health Minor, the Certificate in Global Health, and the Program 2 with an emphasis in Global Health. Now, our Global Health Majors, I might have mentioned that they're the first ones. They are doing something that is very, very unique, both unique to Duke, unique in the United States, unique in the country. This is one of the country's first and only liberal arts majors in the field of global health. And it's offered only as a co-major, which means that they have to fulfill all the requirements of global health, and they have to combine that with all of the requirements from another major on campus, any major on campus. And so in this regard, they're truly taking a very rigorous program of study, and they really are pioneers for us, and I think they deserve special recognition for their hard work. We're also honoring a group of students who have done something that I think of as really kind of going beyond the call. These are students who've completed an honors thesis in global health and in a paired major. So this is what we call a double honors thesis, and they have received graduation with distinction. So let me just take a second and try to walk through this. That sounds really wonderful, but what this requires them to do is to come up with an idea, work with a faculty mentor to bring that idea to fruition, to create a product that requires a non-trivial amount of intellectual engagement, but then to assemble two different distinct groups of faculty in front of which they defend their ideas. And so what they've done is really very special, and I want to acknowledge Madeline McKelway for her thesis in economics and global health, which is entitled The Impact of Microbanking on Health, Evidence from Self-Help Group Involvement in Child Nutrition, and Lily Reed for her thesis in psychology and global health, which is entitled Predicting Engagement in Transactional Sex, a Study of Patrons of Alcohol-Serving Venues in a Cape Town Township. Maddie and Lily, will you please stand so we can recognize you? Thank you. So our Global Health Certificate is one of the most rigorous certificate programs on campus. It requires 6 classes and a fieldwork experience. And the minor is brand new, and it similarly is rigorous. It requires 5 classes. Program 2 is a very unique experience here at Duke. It's really what we call an alternative undergraduate curriculum. It requires students to work very closely with a faculty member to conceptualize an entirely different curriculum than what is available here at Duke. And so our students who are graduating today with a Program 2 in Global Health are doing some really exciting things. Let me give you a sense of some of the boundary-breaking titles from some of these Program 2 undergraduate majors. We have folks in visual media and health disparities, one in social epidemiology, the effects of institutionalized marginalization on minority health, and one in cultural competence, understanding health in developing countries. Now, together, our students reflect the interdisciplinary ethos of our institute and our university. And as an alumnus of this place, and who's married to an alumnus and the father of 2 who I hope will eventually be alumni, let me tell you that I think they represent the best of what a Duke education has to offer. Now, loved ones, I suspect that when you look at your children, you probably remember things, experiences like I had the other day when I was walking with my daughter, and we were sort of walking down the street. I was holding her hand, and she was jumping in every single puddle that she saw along the street. And the dirtier puddles, the better. And I want to ensure you that your students are still out there getting their hands dirty, oftentimes quite literally. And you know, many students at places like Duke take very cushy internships during the summer. Our students eschew cush entirely. They step outside the classroom, they engage in the field, they become part of research, service, and policy efforts around the globe. And along the way, our students confront poverty, the challenges of cross-cultural communication, and very important questions like where the bathroom is. But I just want to give you a few examples of the fieldwork projects that some of our students have undertaken. One student investigated HIV/AIDS-related stigma in urban Ethiopia. Another conducted and interviewed women in over 100 households in rural Tanzania to understand knowledge and behavioral practices and attitudes towards HPV, cervical cancer, and alcohol use. And still another worked with local leaders and a community partner to create a health education program for women and children in rural Honduras. And finally, our class of 2014 is going to go on to do some amazing things. One of the most exciting things about being a faculty member, particularly at a place like Duke, is just spending time with students and really imagining what they're going to do in the world. Every year, I think that I'm ultimately interacting with one of my future bosses. In this case, there are quite a few of them. And with our students, you don't have to do very much imagining. It's very clear that these students are going to take on leadership positions at some of the most important institutions in our globe. And so this year's graduates are doing some very exciting things. We have folks who are pursuing graduate degrees at places like MIT and medical school at places like Harvard, Yale, and Duke. And we also have folks who are working in social services to support low-income elders in Denver, people who are traveling to Haiti to serve a global health fellow in a local NGO, and those who are working to address global health challenges both domestically and through the CDC and USAID. And also, we have a few students who are also joining the Peace Corps. This is a really very special group of students, and we as their faculty see that every time that they step on campus. They really do keep us on their toes, and I think I've had the experience of interacting with some of you and relating anecdotes where, you know, there are quite a few students here who really do push you in the classroom, and we enjoy that thoroughly. But their passion for global health, as Mike described, is one of the things that has really pushed global health to the forefront, both nationally, but particularly here at Duke. And this class is the largest in global health that we've ever graduated, and we're very proud of that. In these 4 short years, the class of 2014 has worked hard, they've learned much, and they've shared their talents and their skills with communities all over the globe. And I've already said that they're a pretty special group. And one of the things that's become very common in the last couple of years is for people in my position to look at the millennial generation and try to remind them that they're not all that special. Right? We've heard a lot of this. After all of you have been telling them that they're special most all of their lives. And I want to dispense with that idea a little bit. To use an expression I think probably only the parents in the room know, I think special is as special does. And a lot of these students, as I've just described, have done some incredibly special things in the world. And to me and to the rest of your faculty, that makes you pretty special people. We're very excited about what you've done here at Duke, and we congratulate you, class of 2014. Now, each year, the Duke Global Health Institute recognizes one faculty member for excellence in teaching and mentoring. Our students nominate a professor, and an independent committee gets all the nominations together and identifies a winner. And this award goes to the faculty member who's made a lasting impression on student education in global health and displayed a special commitment to student learning and intellectual development. The students who nominated this professor described him as having exceptional dedication to supporting his advisees, and a clear passion and interest in promoting sustainable and long-term global health solutions. His advice has always been feasible and realistic, but with a creative problem-solving spin. Overall, every nomination commented on his role as supportive, as flexible, and as a caring advisor, someone who has a selfless drive to serve and guide others. The 2014 Undergraduate Professor of the Year Award goes to Dennis Clements, Professor of Pediatrics, Community, and Family Medicine and Global Health. I'd like to ask Dennis to stand, but he's not here. So what we're going to do, he's out saving the world someplace, but he will be with us today at about 3:15. And what I'd like to ask, I think he'll be with us when we're in the reception area, and when he comes in, students, I hope that you all will actually just rush him en masse and just take out your phones and do some selfies with him, okay? He does not know he's winning this award, and I think that will scare him sufficiently. Let's do that at 3:15 today. Thank you for your nomination, students. You all made an excellent choice. He is going to love that. Okay. So now I want to acknowledge a particular subset of this graduating class for our annual Outstanding Capstone Award. For those of you who don't know, the Capstone serves as the culminating experience for global health students at Duke. In the class, students apply analytical tools from their coursework and fieldwork to a specific and practical global health problem. These are multidisciplinary groups of students. So these are students who come from different parts of the campus with different disciplinary traditions, and they work very closely with their faculty member to try to take on a real-world problem. They do this over the course of a semester. They conduct literature reviews, they gather data, they analyze the problem, and ultimately they write a document. It's a very substantial report, and then they present this project to their faculty. The faculty review this, and we identify one capstone project each year to serve as the most outstanding. And every year, I have to tell you, this is one of the hardest awards for us to decide. I as a professor who teaches undergraduate and graduate students, I have to tell you, the work of these undergraduate students is absolutely exemplary. I sometimes don't want my graduate students to be in the room because they'll be a little embarrassed by some of the really, really well conceptualized projects that are created under the guidance of our really stellar faculty. So I'm going to ask Emily Foltz, Taylor Haynes, Radhika Patel, Camille Knefi-Andrews, and Brittany Zolkowitz to please come down. They really deserve that applause. They tackled a very important issue in global health, postpartum depression in Pakistan. Now, this project was thorough. It consisted of a review of current practices regarding cognitive behavioral therapy in Pakistan. They outlined a proposal to introduce a novel mobile health technology intervention that could increase the effectiveness of depression treatment. And like any other project, this took time. It took a lot of time. It took a semester. It took a lot of time outside of class. It was a really intensive experience for them. But this organization, the thoughtfulness, the commitment of this group was evident from the very beginning. Their work epitomizes what we think of as the best of global health education here at Duke. And their project, along with all of the other capstones, will be in the reception hall after our ceremony, and I hope that you will take a moment to spend time taking a look at them. Congratulations.
To learn more about undergraduate global health education, visit globalhealth.duke.edu/undergrad.